And how you doing, Rach?
Yeah, I'm good. Thank you very much. Good to see you. It's getting a bit cooler these days, though.
I know. Yeah. Yeah. I'm gonna have to get my my heating back on, I think. Yeah. Well, thank you very much, everyone, for joining us. If you're joining us live, we have got a chat facility, so just turn that on there. Yeah. So if you've got any questions, then I can. Hopefully, there we go. I can show them in the chat there, and then we can answer your questions about what we're about to present. So we did a few presentations last week into exercise professional groups, but we wanted to also explain what safety net was for the massage therapy world, because it crosses over quite nicely between the two. So Rach, do you want to introduce yourself?
Yeah, thanks, Mike. So Mike and I have worked together for about 16 years, but I've had about 25 to 30 years involved in broadly scoped movement industry, originally as a professional dancer, then group X instructor, whilst in the care industry actually for a long time, about 10 or 15 years. So some of those skills certainly crossed over as I moved more into strength and conditioning and enjoying biomechanics specifically. And having a real passion for movement, which most of us do, but more heavily involved now in education, alongside what you do, obviously, Mike. But my sort of focus is on biomechanics education, teaching personal trainers predominantly, but sometimes sports therapists as well, the biomechanics coaching model of assessment, and then exercise intervention for risk reduction and optimizing performance, which obviously brings us to our safety net, which is all about reducing risk, keeping people within their scope. Because when we start upskilling with things like the biomechanics coach model or your sports therapy diploma, we've obviously recognised that there's a lack of communication, which we're going to talk about, and also the crossover of learning a multiple sort of set of skills. You know, are we outstepping our remit, and how do we understand what that is? So sort of heavily involved now in promoting working safely alongside you.
Perfect. No, really good. Yeah, I think as we've known each other and over those years and the kind of different qualifications we've done, we've realized more and more the gaps between the clinical world and then the non-clinical world, and often it's a bit confusing and also a bit concerning for some people, because they're not sure how far to take some things and the kind of people that they should be dealing with. Because as soon as you start to have good successes with people, they then recommend their friends, and then their friends have got some ailments that you've never heard of before, and then all of a sudden you feel a bit like, oh, I'm out of my comfort zone a bit. So that's why we put a safety net together. So what I'm going to do, if it's okay with you guys, is I'm going to show you a little presentation that we put together just to give you an idea of what safety net is. So just going to pop that up. Okay, just trying to get me on there as well, hopefully. Bear with me a second. Oh, there I am. Okay.
Do that.
I kind of float around like a bit of a ghost. Okay, so yeah, the whole idea with this is safety, and not just for your clients, but for you as a practitioner as well. So this particular talk is aimed at sports massage therapy students. So I've been teaching sports massage therapy for about 15 years, and started off doing the level 3 qualification, and then I've taught up to master's level on physio modules. So there are some common themes that run through all of the courses, but then there are some where there are clear differences. So just wanted to highlight some of those and some of the challenges that we've had along the way. So we want to bring the non-clinical and clinical worlds together. That's the whole idea with this. And I put in the post that when you use safety net, everybody becomes part of a multidisciplinary team. And that was something that came out of our talks last week. And I thought that was a really nice way of putting it, really. If you're therapist that works on their own. You've only got, it's just you in your house, or you do mobile treatments or whatever you do. Sometimes you can feel a bit vulnerable because you don't have that team supporting you if you've got a tricky client and you're not really sure what questions to ask. So hopefully Safety Net will really help you with those types of individuals. So at the center of everything we do, we have our patient or our client, and we'll talk about the terminology for that in a second. And if you have a look here, hopefully, if we can get this going, there we go. Okay, so we've got for the exercise professional who we spoke to last week, and then non-RC is non-regulated clinician, and that's really important because we have certain qualifications that are regulated and some that aren't, and the unregulated professions have varying levels of assessment, whereas the regulated clinicians have to be on a register, and to maintain your status on that register, you have to undergo a specific exam. So that's why we've got a difference between the two. So the client or patient is in the middle here, and if they've got if the client or patient has a significant issue, then they may need to go to A&E, they may need to go to their GP, or they may need to go to a registered clinician. And we had it was a really good chat. Rachel and I were part of last week in the UK PTs group on Facebook. And there was a girl, Rosie, wasn't it, Rach? She was unsure where to send someone, and who was the best port of call. And then, well, you probably explain it better than I, because you were involved in that conversation.
Yeah, there's sort of common questions come up, and we all know social media is a little bit tricky. But Rosie, as a brand new personal trainer, was concerned about trying to do the right thing with a client involved with a GP, but actually faced with an unhelpful situation, which could have just been from, as you pointed out, Mike, the GP's lack of knowledge of exercise prescription, and she was asking for guidance, basically, wasn't she?
Yeah.
So she was reaching out. She was doing absolutely the right thing, Rosie was, but she was faced with this dilemma of another practitioner not giving her the information, or unable to give her the information she was looking for to then further assist her client, which was predominantly the problem. So as an exercise professional, particularly a brand new one, she felt nervous, concerned, anxious about working with this individual. And there was actually a very high chance she could help her. And all she needed was some written guidance on do this or don't do this, wasn't it? I mean, that was basically it, I think, wasn't it, Mike?
Yeah, definitely. I think quite often people say, "Oh, I've got an issue with a client, and you're not really sure what to do." So you go, "Right, I'm going to send you back to your GP." And as Rach said, the GP sometimes isn't the best person to send someone to. So because they don't have the knowledge of what you do. So then the GP can't really give you guidance because they don't understand what you do on a day-to-day basis. So we need to hook you up with people who do know what you do, so that they can say, right, okay, this technique will be okay. You need to do this exercise or whatever it is, so that your guidance is really clear. And like Ray said, it's all documented as well. So you've got a clear pathway showing exactly what you need to do with that particular person. So your patient or your client is in the center of everything. So they can get frustrated because they feel like, oh, I'm being passed from pillar to post. You're getting frustrated because all you need is a little bit of information to know what to do with someone. So hopefully this is where we help. So I had a little scenario the other week where there was an issue with communication, basically. So if you don't know me already, my background is in health and fitness, and then I went on to study osteopathy, and then did postgrad in anatomy. So that's my kind of pathway. Because I used to teach the level 3 PT, level 4 sports massage, level 5 sports massage courses. So I understand the remit of what is taught on those courses as well. So I like to think of myself as quite an open clinician who wants to help other sports massage therapists. And so if someone's sending a client to me, I'll then message them back with what I've done, what I think they can then do. And I want to pass that person back to the original referrer. And hopefully there are many more that want to do it that way, but we know that some don't, and that's part of the problem. So the issue I had with, and why we've got an MRI scanner here, is because I got referred someone who had some knee problems. It was from on this particular example, it was from a personal trainer, and I did a full examination, clinical examination, and there was nothing clinically significant from those tests that would indicate that there was a clinical problem. The lady had pain, but there didn't seem to be any structural clinical issue from everything that we did. The indication to have an MRI was quite low for me. So I said to my patient, I'm more than happy to speak to your personal trainer about exercises you can do, and I can guide your PT, but I didn't get anything back. They never contacted me. The PT then said to the patient, my patient, his client, that he recommended she get an MRI. And sometimes MRIs can be really, really detrimental to the progress for someone, because you can have abnormal findings with someone who has no pain. So the correlation between abnormal findings on an MRI and pain is fairly weak. So, and also it makes people a bit scared as well, that there might be something wrong, that they would need these kind of tests. So it delayed, in my opinion, the recovery of that lady quite significantly. And then after the MRI, she was then fine. And the pain started to ease off, and then she was able to do her exercises again. So we've got this, we've got a real issue with communication both ways. And so some people are stepping outside of their remit from one aspect, and some people aren't doing what they should be doing in another aspect. So we're trying to bring those back together. So we're all working together so that that patient, that client, doesn't get frustrated and delay in their recovery and exactly what they can do. You had a bit of an example as well, Rach?
Yeah, it's the same kind of thing. And it's, I've obviously had the luxury of being able to work with you as an osteopath, obviously Martin Haynes, who's a chartered physio, but where I've had, and just to sort of say to everybody watching this, by the way, I'm sure Mike will agree with me here, I've made all the mistakes. I've helped people I probably shouldn't. I look back now at some of the people that I work with pain and problems and things, thinking, it'll be fine, because pain is so common. It's seen as normal, and it isn't. It's this alarm signal. So the fact that I have a qualification as a GP referral qualified practitioner, I'm also level 4 low back pain. I teach level 4 low back pain. Kind of implies that I can work with people in pain. The education does stipulate that the only way to do that is with a clinical referral from an allied healthcare professional. And I've spent 6 years trying to set up a relationship with my GP, who I've been with from when I was born, pretty much. And I've not been able to do that. The ability to set that up just hasn't been there for all sorts of reasons. There's a lot of people I can help that do have pain, and what I've been able to do is use yourself and Martin as a referral network with written documentation. The problem is I've had clients come to me and say, I've been told that you can fix sciatica, and, all sorts of misconceptions about the qualifications I've got. And it might be misleading to the industry. But over lockdown, I've helped a lot of people online, purely online, who are in pain, but only because I had access to a version of safety net. through communicating with clinicians like yourself and Martin. Prior to that, I didn't. And I think there's also a lack of awareness, certainly in the exercise industry, and I think also in sports therapy as well, about exactly what the remit is, based on some ways we're educated and some qualifications we get and titles of some courses. But I've hit a lot of sort of barriers when people have come to me that actually probably needed exercise. And I think we worked out over the period of lockdown, about 85% of people that came to me and Martin in pain just needed exercise. He, as a clinician, was able to clinically analyse their problem, question them further, which is what the safety net's doing, and then refer them back to me with a written guidance. Without that system in place, I couldn't do that. So I was having to just turn people away. You'll have to go and see a physio. You'll have to go and see someone else. Then when they came back, I would say, what did the physio say? What did the other guy say? And they'd say, oh, he said it was fine. I could exercise again. But there was no structural guidance, or certainly nothing in writing. And so as I've become an educator and worked with you and Martin, obviously over the last sort of half of my career, I started to almost recognise, wow, there's a big risk out there of professionals being given certificates like me that say I am a low back pain specialist. They say this on them. And yet I feel really ill-equipped. But maybe people who are unaware of the risks and the dangers, and it is that risk of not knowing what you don't know. I don't mean people doing this kind of deliberately or sneakily. Yeah, it'll be all right. I mean people who literally don't know. They don't realise, and I don't know how far through the ranks of a gym that that ignorance goes. I'm not sure, but this is where the safety net has freed me in a very quick, simple and safe way to actually work with a lot of people in pain. But it's that very small portion of the referral to a clinician who says, no, that's okay, but do this and don't do this, has suddenly given me the ability to actually utilise my certificates as a GP referral and level 4 low back pain qualified exercise professional. So it is a freedom tool. It's like a relief. It's confidence building for both me and my clients, Mike.
No, that's it's really good. Yeah, I think and again, I mean, with the advances we've got now, especially over the last year and a half, I'd never heard of Zoom before the pandemic, and then everybody was using Zoom, and patients and clients are used to it now. And what it does is it opens up the whole country, so that you're not confined to your local area. So if you're in a little village somewhere and you've got your local physio, and for whatever reason that there's the communication barriers just aren't there, we now have the opportunity to use online assessments, and you can very easily see a physio online or another regulated clinician online, and get the answers you need really quickly. So you're finding the right person rather than the person in your area. So that's really encouraging. So just wanted to go over some of this. So this was taken from the VTCT website, literally about 20 minutes ago. So bang up to date. This is the scope of practice for different levels. So a level 3, you're able to do sports massage treatments, basically. Level 4, but very similar with certain techniques, and then paratendon pathologies. And then level 5, complex assessment techniques, complex massage, and you're allowed to work on what so-called dysfunctional tissue, whatever that is. But there nowhere in the scope of practice does it say diagnosis. So diagnosis is beyond the remit of level 3, 4, 5 sports therapy qualifications. And if you have a look at the scope here, so yes, you're able to work on dysfunctional tissue, but you need a diagnosis to know what dysfunction it is. So if you haven't had a diagnosis from someone and someone has a specific issue, then really we need to make sure that we've got that information before we can proceed. So this is the scope of practice of a regulated clinician. And what we propose is linking the two together. So we've got a 3-year degree course for physio, and it's specifically in their syllabus, it says that they can use diagnostic techniques. In osteopathy, it's a system of diagnosis and treatment, and then chiropractic as well. Chiropractors are trained to diagnose, treat, and manage and prevent disorders of the musculoskeletal system. So it's specifically put into the syllabus for these particular titles, because these are all protected titles as well. You're not allowed to call yourself an osteopath unless you're on the osteopathic register. Same with physio and same with chiropractic. So you have to do these degrees, ranging from 3 to 5 years, depending on what you do. And a lot of time is spent not just on the musculoskeletal system, but also on general health. Usually what happens with a sports massage therapy course is that you focus on musculoskeletal issues, which is great. And you become a very well-rounded person who can help someone with musculoskeletal problems. The problem is, though, some musculoskeletal problems may be a masquerader. So, and I gave an example last week of a chap who'd come to me after seeing various massage therapists, acupuncturists, and he still had this pain in his shoulder. It wouldn't go away. And that on questioning him, it was clear that there was something else going on. And I thought it might be some kind of systemic problem. And unfortunately, it turned out that that guy had lung cancer. And lung cancer is one of the things that can cause a referral to the shoulder and pain up into the neck. But it's just not covered on sports massage therapy courses. That level of questioning, it is just not there. So, and this is what Safety Net is about. It's about asking those really difficult questions that you wouldn't even think about asking with someone with shoulder pain. And there are some key parts to the Safety Net system that help identify those general health problems. So basically, we've got a pathway through the system. So Safety Net, the person is a client, and this is for the sports therapy guys. Okay, so they're your client. And then when they pass through to the Safety Net system, if something gets flagged, and we'll show you that in a sec, they then become a patient of the clinician that is recommended for them. And then they come back to being your client again. And that's really important. Like Rachel was saying, we need that link back to you with guidance so that you know exactly what you can and can't do with that individual. And and that's hopefully how the system all works together. These are some of the things that we've identified. So when Rach did a bit of a analysis of the of her groups, and these were the issues that were coming up. So the lack of communication between allied health professionals, regulated clinicians, and yourself was really poor. Sometimes it was good, but on the whole, it was generally poor. And you lost your client. Okay, they didn't come back for whatever reason, or they weren't even sent back. Okay, because the whoever they went to see, they kept them and they kept hold of them, and that's something that we passionately believe should not happen. They should be referred back to you with clear guidance on what you need to do. Okay, fair enough to say, right?
Yeah, and I think particularly with this audience that we're talking to today, Mike, also the exercise world as well, but I think sometimes we feel we have a responsibility when a client expects us to fix them because they have a problem. Mm-hmm. And so I think this is kind of almost marked, because we're getting really quite well skilled, or we're getting better skilled than we were. The client expects us to help, and we care, so we want to help. The client, I think a big problem, the client comes and says, oh, the physio's rubbish, they haven't succeeded, I've still got the problem. So we think, well, I'll help then. But that just pushes us over outside our remit. Do you know what I mean, Mike? Where that you feel like you want to help, and it almost, you care too much, I think we call it, don't we?
Yeah, no, definitely. Yeah. And leave yourself vulnerable, I think. Yeah, and it 99% of the time, it probably, they'll probably be okay, but nagging in the back of your mind, you won't actually know 100%. And yeah, and well, this will give you that 100%. So yeah, so these were the key things for us: clear instructions to the referrer. So clear instructions to you as a level 3, 4, 5 sports therapist, sports massage practitioner. So when you send someone to someone, you will get feedback back in layman's terms so that you can understand exactly what you need to do. The whole process is fully documented. And this is important, like Rachel was saying, for the GP referral qualification in the exercise world, and then the specialisms in lower back pain. You have to have that referral process. You have to have it documented. So this does it for you. Okay. And the same with sports therapy as well. So in the sports therapy world, you obviously need that referral pathway. You need that documentation to say, yeah, that you're okay to work on them. And this will do that for you. There's complete transparency, which you will see, and hopefully you'll build networks, not just in your local area, but now all around the country. So I just want to run you through. Oh, there we go. Yeah.
Up there, sorry, Mike.
Say again.
There's a question come up from Becky. I'm not sure how I can't seem to write in an answer. She says, why is it that a physio who works with MSK injuries can diagnose an MSK issue when their module in MSK is significantly shorter than an ST degree?
It is mainly to do with the external exams that they do. So with the degree program, with the SST, even in the SST guidelines, it doesn't state that a degree trained sports therapist can diagnose a condition. It says about clinical reasoning. It's one of those really gray areas that the sports therapy world unfortunately hasn't been able to tighten up. The other thing that you have within the degree programs for the regulated professions, you have an external exam, so to enable you to then go onto a register. So for example, with osteopathy, obviously that where my background, we had our osteopathy degree, and we had exams to pass the degree, and then we had to take an external exam to prove to someone outside of the university that we were safe enough to make a diagnosis. And it was all about it wasn't just about musculoskeletal health, it was about general health, and being able to identify those red flags from other parts of the system that may be masquerading as an MSK problem, and that isn't on. Well, it wasn't on the degree that I used to teach. That the focus was purely on MSK. So the sports therapy guys that are coming out with a degree are really good with the MSK issues, but they don't tend to get examined on the general health questions, and that's the bit that's different. And when you're looking at the assessment process of each of those degree programs, that is the one bit that's missing from a sports therapy degree that would make it very, very similar to physio. Right? So it's all in the exams.
Isn't it to do with regulation as well, Mike? Which is obviously the point of safety net, defining what a regulated practitioner is. So physio, osteo, chiro are regulated in terms of they can only use that professional title if they are registered, whereas in sports therapy, they're not yet regulated, a bit like the exercise world.
Yeah, there we go. I've just found out how to get the question up there. There we go. Yeah, you're absolutely right. Yeah. So, I mean, again, with the SST, they have their own register. But you could come off of that register, still call yourself a sports therapist, but you don't have to belong to any membership organization. And again, that I know the frustration with sports therapists. I know that that's an issue, but that's one of the big problems again, because there's no control over post qualification. And yeah, it must be so frustrating. I mean, I didn't realize that when until I got into teaching it. Yeah, it's really frustrating. So just put that. It strikes me as odd. Yeah, interested. Yeah, no problem. Yeah, wonder whether there would be a multidisciplinary reason for it. Yeah, so it really is that. So it's because of the on osteo and on chiro and on physio, we do abdominal exams. We do respiratory exams. I know you SST or sports therapy, you do neuro as well. We do neuro exams, and what else have I missed out? We'll do a thyroid exam. Yeah, we're taught those examinations. We're taught the questioning behind those pathologies to see whether, but our expertise lies in MSK, in osteo especially, and chiropractic. Physio is a bit broader. But it's all in being able to do those examinations. So and the questioning behind those particular issues as well. It's yeah, until the SST recommend the changes to the syllabus to boost those examinations on general health, I think you will always struggle to be able to make a diagnosis, because you've only got a bit of the picture. You're very good at that bit, but the rest of it isn't there, unfortunately. Good question. Thanks, Becky. So I mean, this really is aimed at level 3, 4, 5 rather than degree level for sports therapy, because on level 3, 4, 5, I mean, level 5, you can complete that course over 10 weekends usually. So that's obviously just under a year's course. So it's usually a weekend a month. Nowhere near as in depth as your degree, Becky. So that this is really where this is aimed at, is those level 3, 4, and 5 qualifications that have studied for less than a year, because you're going to have a greater knowledge of musculoskeletal issues having done a degree and being assessed in that. But the level 5 guys, they won't have had that your level of assessment, right? So I hope that makes sense. That's okay. So this is what you'll get, basically. This is what you'll get using the system. So the therapy professional pathway. So that when you request someone to go onto Safety Net, so you get a new client come in, and we recommend every client goes on it. And then when the client fills in the form, or when the client gets sent the form, they get sent this. So they'll get an email sent to them which details, okay, so-and-so, your clinician has asked if you can fill this form out. So you click here, and then it goes through to the Safety Net form. That's supposed to be a video, but it doesn't work on PDF. Never mind. So just move me out of the way. So Safety Net is a series of over 80 health-related questions, whereas what we tend to get on level 3, 4, 5 is contraindication list. And it's, have you had a fracture? Have you had a sprain? Are you pregnant? All those kind of things. They are conditions that you know that you've had. What this looks at is things that you don't know that you've got. So these are undiagnosed conditions, and the whole point of it is to try and detect those underlying health issues that you may not be questioned about. Okay. It seems like a lot, 80 questions or over 80 questions, but it takes around about 3 minutes to complete the whole thing. So it's not a massive war and peace. It's something that can be done quite quickly, and because it's electronic, you can do it before the appointment, so you can get this information and get the clearance before they even come in, which is even better. So what the system does is it gives you a traffic light. So you either, okay, you've got these problems that are red flag issues, and which, going back to Becky's point, you should be able to identify most of these and go, actually, you need to go to A&E. Yeah. But for those that have done level 3, 4, and some level 5 courses, you will struggle to know what questions to ask to whether someone needs to go there or not. So this will sift those out for you. It will sift them through. If they answer certain questions, then it may recommend going to an allied health professional, so registered clinician, or to their GP. So if it's a musculoskeletal problem, the system will recommend you go to an allied health professional, because the GP isn't skilled in those things like we were talking about before. Whereas if it's a general health issue, then it should be signposting you towards the GP straight away. Yeah. So yes, we can deal with those issues, and we would ask questions around that as well. But they will be, what you don't want to happen is coming to a regulated clinician and then them referring to the GP. So we want to try and save the time. Or you get the green light and you carry on. Okay, so and then you get that before they come in for their appointment. They get the green light, carry on with their appointment as usual. Okay, so as a level 3 sports massage practitioner, that is, well, I wish I had it when I first started. And this is what you get. So talking about transparency, the client gets sent the decision. Okay, based on the answers that they've given, and it says we recommend that you visit this person, we recommend you go to A&E or whatever. Okay, the good thing is not only do they get it, but you get it as well. So you get kept in the loop about what's going on. So this is obviously back to me. So I've sent someone and they've said, right, they've filled in the form, and your client, we've recommended that they go see a regulated clinician. Okay, or whatever the recommendation is. So this was the thing that was really important to us, that you were kept in the loop. So they filled the form in, they get sent an email saying go to see this person. We also get an email saying they have been recommended to go and see this person. So you know what's been going on with them as well. Okay, and then the beauty is there's a dashboard. So your client will then be listed in your dashboard. It will tell you when the safety net form was sent. It will tell you when it's been completed, and it will tell you the result. And then in here in the action section, we've got these shared notes. So when they go to see the clinician and the clinician fills in the notes, you will get to see the medically unsensitive notes. So whatever the clinician and the patient want you to see, you will get sent that information detailing what you should do, and everything is on your dashboard. Okay, so when the client gets sent the referral letter, just get rid of that one. When they get sent the referral letter, I'm on there twice. That's no good. Then you will if they want to go and see someone within SIF Health who hosts the system, then they can see one of those clinicians. If they have got someone that they want to see themselves, they will get sent a code, and that clinician can use that code and use Safety Net free of charge to fill in their notes to feed back to you. Okay, so they don't have to be on the SIF Health system for them to be able to use it, right? And so it's free for clinicians to use and to help you, and then you get the information that you need. So hopefully that all makes sense. I'll try and not make me two again. So anything to add, Rachel? Does that sound okay?
I just want to pick up on Becky's point and the kind of the frustration that I hear coming through, which is, as we recognise, it's very common for particularly degree level sports therapists. But for everybody, whether they're level 3, 4, 5, degree level or whatever level they're trained at, the people we're aiming this at, it's to highlight there's that very small percentage of the population who are extremely high risk, that they don't know it and we don't have the skills to identify that. And so I think this is where the safety net really comes into the fore. So as we've highlighted, there's a massive percentage of people in pain with problems that just need simple solutions, simple assessment tools and solutions, whether it's manual therapy or exercise, that Becky, myself, and other non-AHPs could bring to the table. But for us, there's that small missing piece of the puzzle for the small population out there that actually they're the ones that we really need to protect more than anyone else. The ones who don't know they have a clinical issue, that we're not equipped to diagnose and ask certain questions of, and then refer to, certain other practitioners. So this solves that issue. And the second really wonderful thing about it is the speed at which it can do it. So anybody out there who does work with GPs, who've managed to set up schemes with other professionals, brilliant. The problem is the time it takes to wait for that referral, to wait for the information, and then to get the right information through. Safety Net solves all of that quickly, easily, safely, sensitively, and connects, as you said right at the very beginning, Mike, for anybody watching this. Part of the safety net point is it immediately makes all of us part of a multidisciplinary team. You, Mike, and myself, we can all work together online as far as is possible to help people out of pain. I mean, it's just, I'm so excited by it. Sorry, I'm getting more excited when I listen to you talking about it. It just solves all the problems that we face.
No, definitely. Yeah. I mean, it's something that, like you said a little while ago about, we've been using a crude format of this for quite some time, and amongst just ourselves. And now with SIF Health's involvement, we've been able to make it on a big scale, which is brilliant. And just on the bottom of the screen there is a free 7-day trial. And I guess you think, Jesus, how much is this? Because it sounds expensive. It's $4.99 a month, and you can put as many clients as you want through it. Okay, so basically what we're saying is that this can replace your contraindications list, and it becomes an electronic form. It will also ask a heck of a lot more questions than your usual contraindications list. But as Rach said, it will also pick up those things that they don't know they've got. So it will highlight those risks. Safety-net.online. There's a free 7-day trial, so you can give it a go. And if you like it, it's been live for about a week now, hasn't it? So what we want you to do is hammer it. We want you to try and break the system. So we want you to try and put as many people through as possible. Because as with everything new, there are always teething problems, and we know that the system works well. It's just the user interface we want to know whether it's user friendly or not. So if you could give us that feedback, that would be really important. And like I say, it's free for 7 days, so that would be brilliant. And thank you, Tristan. I really hope so. Yeah, I really do. I think. We've needed something like this for a while, I think. And screenshot that. I think we're really excited because a lot of the education providers in the fitness world and some in the therapy world as well are interested in embedding this in their qualifications, so that new guys coming through at level 3, especially, because I think they're the most vulnerable to these kind of issues. They just use this from the very beginning, and they have that safety net from the very beginning. Hence the name. So cool. Thank you everyone for listening. Thank you for your comments. Some really good questions as well, and more than happy to chat to anyone about this. Can it be a subscription for a clinic, or does each practitioner have to sign up? See, these are the questions we need. I have no idea. I think this is one for Malk, isn't it?
I think the clinic can join, and then you would have practitioners in your clinic. And I don't know the answer to whether it would be £4.99 for the clinic per month, or whether it would be then £4.99 for practitioners. I'm not actually sure. So it's a great question, Ali. I'll write it down and find out for you.
Yeah, brilliant. Yeah, so these are the kind of things we need to think about, the practicalities of being able to use it. Yeah, no, thank you for that, mate. Like I said, we're working with SIF Health on this. They provided the platform behind it, and we've been developing this over the last sort of 6-8 months. So those kind of things, some of those things we may not have thought of. So the guys at SIF Health, if you've dealt with them before, they're really responsive, really reactive. So things like that, we should be able to get an answer back to you pretty quickly. Okay, brilliant.
Do you know what's really exciting? We could all actually be working together.
Yeah.
All of us.
Yeah, I'm on holiday. Yeah. But no, but it's so good. And we're going to be using it on the diploma. We're recommending it for our diploma students. So because again, we teach about these pathologies on our diploma course. That's one of the things that we like to set ourselves apart from. But again, we don't teach it to the level that you would get on a degree program. And we certainly don't assess it the way that I was assessed on my osteo degree. We give people an awareness that there may be some other issues going on, but not the skills to be able to assess it competently. So something like this will just help it. Well, it should help really everyone. So even those that are clinicians that think, "Blooming heck, I've forgotten those questions." It should help them as well. We are going to be putting together some training for this, for therapists and for clinicians, so that we can show people how to work better together. Because I think some clinicians use wording and terminology that at level 3 you just wouldn't understand, and that's part of our audit process as well. So the feedback that goes back to the sports massage practitioner, we will be looking into that and seeing what kind of feedback you're getting, and grading the clinicians to make and to help them improve their feedback to you. So again, it's all about that transparency and the communication. So very exciting. Cool. Thank you, everyone. I'm going to sign off, and if, like I said, any questions, just get in touch. So best place to get in touch with you, Rach, where would be the best one?
Biomechanics Education, Instagram, Facebook, the usual places. So yeah.
Brilliant. Movement therapy education for me. Just look me up on Facebook. You'll see me there. Cheers, guys.
Thanks, Mike.